BodyTite is the first device developed by Invasix Limited, an Israeli-based high-tech company developing a broad range of products for the minimally invasive cosmetic surgery market. The company has an extremely experienced team of engineers, scientists, and medical professionals with successful track records in cosmetic medicine. Invasix is based on patent-pending revolutionary technology deployed in devices for cosmetic surgery. It takes treatments such as liposuction and the new minimally invasive skin tightening procedures to a new level. Invasix is focused on the development of new technologies and procedures in cooperation with leading plastic and cosmetic surgeons in the U.S. and around the world. The BodyTite body contouring system is the first device utilizing radiofrequency-assisted liposuction, RFAL, for lipolysis, blood coagulation, and skin tightening. A minimally invasive internal electrode is inserted into the adipose tissue, while a second, larger electrode is positioned on the skin surface above. RF energy is concentrated near the internal electrode, which liquefies the adipose tissue and coagulates the blood vessels. RF current flows from the internal electrode towards the external electrode placed on the skin surface, and the power density is regulated based upon online measurements of temperature and impedance, providing thermal skin contraction safely, precisely, uniformly, and with reduced risk of damage. Moving the handpiece through the treated area, the physician liquefies adipose tissue, coagulates blood vessels, and heats skin uniformly up to subnecrotic temperature levels, where it can maintain tissue temperature for optimal soft tissue contraction. Online monitoring of skin temperature, RF power, and change in tissue impedance makes this device extremely safe while allowing higher power levels and rapid speed of treatment. Liquefying the adipose tissue prior to extraction allows less traumatic fat aspiration and, as a result, less pain, edema, and a more rapid healing process. Blood vessel coagulation reduces postoperative bruising. Uniform heating of the skin and connective tissue results in soft tissue contraction and skin tightening, which significantly improves surgical results in those patients with decreased skin tone. The BodyTite device is the most compact and ergonomic energy-assisted liposuction device on the market. In addition to the efficient design, BodyTite is also the most powerful liposuction device on the market. The device is alignment-free, upgradable, and simple to use and install. Foot switch-activated RF power frees the physician's hands for the surgical procedure. The extreme design intelligence of the BodyTite provides unmatched safety features, including closed-loop skin temperature and impedance monitoring, limiting RF power delivery, anti-carbonization cannula protection, internal power calibration and monitoring, external electrode contact control. The color screen interface is simple and intuitive, providing maximum control of each treatment with minimal parameters. An audible signal alerts the physician about specific tissue heating characteristics and operator-controlled thresholds. The BodyTite surgeon can control RF power, maximum skin heating temperature, sound level, and impedance limits. Skin temperature and total delivered energy are monitored and are presented on the screen. The BodyTite handpiece consists of an internal electrode coated with Teflon and a blunt, bullet-nosed conductive tip. The external electrode is about 1 inch in diameter and has an embedded temperature sensor for monitoring skin temperature. An adjustable eccentric mechanism allows the control of the distance between the electrodes and therefore control of the minimal and maximal depth of treatment. BodyTite treatment depth can be controlled from 5 mm to 25 mm with adjustable increments of 5 mm. All parameter and power enhancements are simple BodyTite software upgrades. After tumescent anesthesia, use the same port for the RFAL treatment. When starting, treat deeper layers of fat, delivering adipose and vascular tissue coagulation, until there is a significant reduction of mechanical resistance. It is safe to use power levels of 35 to 50 watts. Limit the skin temperature elevation to 40 degrees centigrade and divide the treatment site into thermal zones, which are 15 by 10 centimeters. As a general rule, do not leave a thermal zone until the deep space resistance is reduced and the skin temperature has been maintained at 40 degrees centigrade. The body tite technique involves using one hand to move the handpiece back and forth uniformly through the subcutaneous tissue, while the other hand controls the contact between the external electrode and the skin. The handpiece is easy to use and provides sufficient stiffness for accurate control of electrode position. After treatment of the deep fat, reduce treatment depth down to 5 to 10 millimeters and treat the more superficial subcutaneous tissue area until the skin reaches the preset cutoff temperature of 40 degrees centigrade. At this maximum temperature, the system automatically turns RF power off and on to maintain the desired temperature. It is best to maintain this temperature for a few minutes to achieve perfect uniformity and increasing the soft tissue contraction and tightening effect, which is not just a function of temperature, but also the duration of time that the temperature is applied. Thermal evaluation with an infrared camera proves that the body tite device provides fast and uniform heating of tissue. High uniformity of heating is reached due to a closed feedback loop between temperature measurements and RF power delivery. Melted fat leaking from the incision port is observed under thermal evaluation during treatment. This fat liquefaction effect makes the aspiration process less traumatic, nearly bloodless, and almost effortless. This control mechanism provides 3 major treatment benefits: rapid tissue heating without increasing the risk of burn, uniform heating of the entire treatment area, and ability to sustain the desired maximum temperature for optimal skin contraction.
We've done several cases starting in September, and what we have noticed so far are the following. First, we have the appearance, at least of patients on the operating table, where one can see the treated side versus the untreated side already beginning to show a flattening of contour before the fat is removed. What that means is that the dissolving of the fat is visible as it changed from a convex surface to a flat biplanar surface. The second thing we observed is less bruising or ecchymosis in the areas where the fat's been removed using this technology, as opposed to standard liposuction, either mechanical with just the use of the hand back and forth, or using a micro air or other technologies to help remove the fat. Another thing that we've noticed with the use of this technology is that the patients require little, if any, pain medication. The level of pain that they're experiencing, even after doing several liters of aspiration, has been remarkably minimal, and patients are extremely comfortable, seem to be able to go back to their usual activities within a day or two rather than a prolonged downtime.
The body tite device, based on RFAL technology, is the ultimate evolution in cosmetic surgery. It addresses 3 major problems currently existing with energy-assisted liposuction treatments: uniformity of treatment, less pain and bruising, and most important, it provides optimal skin tightening, which should broaden patient candidacy and significantly increase patient satisfaction from the liposuction procedure. Finally, all these critical improvements are reached without compromising treatment speed or safety, making body tite a revolution in body contouring surgery.